My dear students, welcome to R.A.T.S in pathology. The expansion of it is given in the box. You people shall go through. But the key for today's class shall be UQs, which means university questions. And in the enclosure behind me, you people see something called tips. You shall decipher what it is. These are the topics that I shall be covering in today's class. I shall be a little rapid but clear in my presentation. And the importance of it is again given in the enclosure. Kindly go through these. The first short note shall be atrophy. And look at the definition over here. It runs to about 3 lines. In my opinion, definitions are definitions. There is no own word for it. Solution, for example. A solution is a homogeneous mixture of the solvent and solute whose composition can vary continuously within certain limits. So let us go to atrophy now. Atrophy is defined as a decrease in the size and the number of cells, and hence the size and weight of the organ or tissue. It is a form of adaptation, of course. All these come from the Greek word trophos, which means nutrition or nourishment. What are the general causes of atrophy? Lack of nutrition, lack of blood supply, disuse atrophy. Sometimes when an organ or an extremity is not being used, there can be a disuse. Decreased hormonal stimulation. Old age, senile atrophy. Disuse atrophy again in paralysis. Lack of neuronal stimulation in the case of poliomyelitis. These are all a plethora of causes which you people should remember. And this is a beautiful diagrammatic representation of the cerebrum. On one side, I find that there is a healthy cerebrum, the sulci and the gyri can be seen, and it is obviously larger and heavier. And on the other, I find that it has become smaller, the cortex has become thinner, and then there is a widening of the sulci. Also, the ventricular spaces have become larger because the cerebral parenchyma has been reduced. This can happen in old age, but Alzheimer's disease is one of the classical examples that we people should bear in mind today. Whatever be the cause, you find that the size and the weight of the organ is reduced. It is a form of adaptation in the sense, if you can take the tissue back to its original milieu interior, if you can give the same blood supply and same endocrine stimulation, it can revert back to normal. That is why it is called a reversible injury or adaptation. Look at this, for example. This is a picture of the villi of the intestine. They are all tall so as to increase the area of absorption. But then you find that there is a flattening and almost an atrophy. This happens in the case of celiac disease. An endoscopic biopsy will prove this. And when the original texture is restored, the normal function can also be restored. Morphology. This morphology is not pertaining to the pictures, but to any organ of atrophy. You find that the size and the weight is reduced. It becomes more yellowish gray due to the replacement of the parenchyma by fibrofatty tissue. Microscopically, you will be finding a reduction in the number of cells, reduction in the size of cells, and they will be separated by fibroconnective tissue. No active mitosis. So this is a summary which I would like you people to write if a question is asked. And this incidentally is a couple of patients who have undergone a lack of innervation due to poliomyelitis. And There are a few disorders like poliomyelitis, muscular dystrophy, etc., which can lead to weakness of the extremities. Atrophy of the testis. Always rats and game go hand in hand. I would like you people to go back to game because I would have described some specimens and slides in detail which you can apply to practical theory as well as viva. Anyway, now let us come to the slide. These are all the seminiferous tubules. All of you know the seminiferous tubules of the testis. Generally, they are all very closely packed. Even these two are at a distance. But here, I'm finding wide separation. There is a lot of stroma that is there, and this happens in old age, a senile atrophy of the testis. There is another condition wherein this is again a tubule, but look at the pink material that is deposited around. This is called thickening of the basement membrane. And normally there are two types of cells. There is a germinal epithelium and then there is a Sartoli cells. In this particular slide, I'm finding only the Sartoli cells. They are cells of nutrition, but the multiplying cells are not seen. This is called a Sartoli cell only syndrome. This can happen in a case of cryptorchidism. Here again, I'm finding a normal testis and this is an atrophic testis. The scale is there for you people to compare. So there is an obvious loss. This nourishment or the color I'm not able to make out over here. The size is reduced and microscopically there is a thickening of the basement membrane. This can happen in a case of cryptorchidism. I would like you people to go to the chapter on testis also because cryptorchidism by itself has been asked as a question. Describe and draw. That should become a habit for you people. This is a normal muscle bundle. These are the various muscle fibers with the eccentric nucleus. They are all closely packed. But then when there is going to be a disuse or a lack of nourishment or a lack of innervation, there can be an atrophy of the muscle fibers. Similarly, if a person goes to the gym or if there is going to be a manual labor is a person who carries the material for construction, etc. Manus means hand. He develops hypertrophy of the muscles. So this particular diagram, it carries a lot of message. Please draw it. I always say go to game. There is something in this, I will be coming to you repeatedly. There is no fame, no gain. If there is no game, again there is no fame. Please remember this repeatedly. I would like you people to couple this with what you are seeing behind me. Hypertrophy hyperplasia. This is another set of questions. Hypertrophy and hyperplasia generally go hand in hand. As I mentioned earlier, atrophy means decrease, hyper means increase. Therefore, there is an increase in the size of the cell and hence the size of the tissue or organ. That is called hypertrophy. Plasia, remember P for proliferation, multiplication. Hyperplasia means increased multiplication. So in this I find that there is an increase in the size. In this I find that there is an increase in the number of cells. Look at this over here. So this is supposed to be a normal healthy cell. It undergoes an enlargement which is called hypertrophy. Or there is an increase in the number. Count the nuclei alone. You find that there is a hyperplasia. This diagram also denotes the same, and these are for your eyes only. A famous James Bond movie. You people can choose whatever you want, but then draw the diagram in your exam. The diagram will carry nearly 10 to 20% of the marks with or without saying. I would like you people to comment on both the pictures. In one, it is a Somali child. There is a total lack of nutrition, malnourishment, and there is such a dejected, apathetic look at the same age itself. Loss of weight. And a lot of other things are there which we will be seeing under kwashiorkor and marasmus. And here, there is a gentleman like you people who wants to display the muscles. Of course, the medical students We all have got ribbon muscles all over the body. There is nothing called as deltoid and so on, which you people can display. But my comment here is both of these have got an equal right to survive. It doesn't mean that this person can be allowed to live and this person can be allowed to die. So that is an important message which you people shall carry as doctors. Hypertrophy again I am going into. So this is the ventricle. So left ventricle and the right ventricle, left atrium and the right atrium. The other major vessels you people will be knowing. But I have got something here. In one, if the patient is going to be having a hypertension, there is an increased resistance to the flow of blood. Also, sometimes when there is going to be an incompetence of the blood vessel, blood valve, the aortic valve, the blood again comes back. So in either case, you find there is a lot of pressure on the ventricle. Here, the blood is supposed to be pumped against pressure. Here, more volume of blood comes back. Therefore, it is a case of hypertrophy. And this is a principle. If you apply pressure at any one point in a fluid, it is transmitted equally in all directions. And this is what is happening in a case of systemic hypertension, aortic stenosis, or aortic incompetence. If you people are not convinced with what I have mentioned, see these. So this is something that you people should draw. So this is the picture of the left ventricle and this is the right ventricle. The right ventricle, it is almost normal. The left ventricle, the wall is thickened. I call it as concentric hypertrophy because the wall is uniformly thickened. The lateral, medial, anterior, posterior, all are being equally thickened. This is called concentric hypertrophy. There is another type of hypertrophy called eccentric hypertrophy. This is obviously a specimen from an autopsy patient. Otherwise, you will not be getting the heart. I find that there is a massive thickening and then there is a narrowing of the lumen of the left ventricle. The conditions I already mentioned. This particular diagram you people can draw. A normal heart and then the hypertrophic ventricle. These you will be finding here. Courtesy Alani. This is another example of a hypertrophy. Now this is a normal sagittal section in a female. You people should be pioneers in it. You have got the bladder over here, you have got the cervix and the uterus, and this is the rectum and the anal canal over here. Normally this is there, but then a lady becomes pregnant and then the fetus grows in size. You people know what an amount of pressure it is going to exert. If the lady were to have a same volume of or thickening of the muscle, obviously the uterus will become a balloon, it will rupture. So it has to become thickened, it has to become hypertrophic. This is a classical example of a physiological hypertrophy. What I had shown you earlier is a pathological hypertrophy. Again, one more example of a physiological hyperplasia in this case. More than hypertrophy, I would like to use the word plasia. Plasia means proliferation. This is a breast tissue. I am seeing the duct, I am finding the acini or the glands. And these are the lobules in which the glands are contained. And there is a lot of stroma that is supporting it. When a lady attains menarche and then grows, you find that there can be some amount of proliferation. But then look at this over here. It may be the same lady. When you take the breast, you find that there is a back-to-back arrangement. Back-to-back means very closely packed, hardly any space. There is a proliferation of all the glands over here. And this is a typical example of a lactating breast, which is again a physiological hyperplasia. Increase in the number of cells, increase in the number of glands, lack of intervening spaces. This is our friend, the prostate. So normal prostate is over here, it is at the neck of the bladder, and normally it has got a sphincter-like action. So a verumentanum is over here, which maintain the sphincteric action, but then as a person grows older, you find that the prostate becomes larger. There are different parts of the prostate. I'll be dealing with it under prostatic hyperplasia. The central portion of it, it becomes larger, it becomes lobulated because there is a proliferation of the glands. Look at the glands over here. They become more in number, and then there is a folding of the lining epithelium. Also, the stroma is also thickened. So it becomes larger. So this can be the stroma over here, and this can be the glands. So there is a hyperplasia or a hypertrophy. In fact, both will be present in the case of prostate. It is a change of age. And this is used to, because of an aging process, it can be hypertrophy and hyperplasia combined together. Glandular and stromal elements are present. There is a decrease in the testosterone. The bladder wall becomes thickened. It also undergoes some amount of hypertrophy because of resistance. The patient develops the classical symptoms of urgency, frequency, hesitancy, and a dribbling of urine. This your surgery professor will be telling you. Again, remember this. No fame without gain. Always go to gain. This, I hope you people will be able to identify a normal brain, and then this is a atrophic brain. You people should be able to explain the points of there will be a decrease in the size, etc. Hyperplasia, as I mentioned earlier, is an increase in the number of cells, and hence the size and weight of the organ or tissue. Opposite of atrophy. Atrophy and hyperplasia are opposite poles, whereas hyperplasia and hypertrophy go hand in hand simultaneously. Dear students, I would like you people to kindly observe both these columns. One is a set of physiological hyperplasia, another is pathological hyperplasia. In physiological, the examples are a developing breast. Second one, a lactating breast. Third is a proliferating bone marrow. And fourth, compensatory hyperplasia. For example, when a patient undergoes a partial hepatectomy, there is a proliferation of the remaining lobules. Pathological, on the contrary, it can be cystoglandular hyperplasia, hyperplasia of the adrenal glands, whenever there is an increased stimulation by adrenocorticotrophic hormones. Follicular hyperplasia of the thyroid by thyroid stimulating hormone. And strangely, prostate, a senile prostate will be undergoing a hyperplasia and a hypertrophy. These are things that you people should remember. I hope you people, definitely you will not be knowing, but try to find out what it is. Supposed to be a very famous movie. I would like you people to kindly go to the net and see it. The last clipping was on a famous movie, The Good, the Bad, and the Ugly. And now what am I going to show you people? The endometrium. So here you find that there is the normal endometrium, well punched out glands separated by a cellular stroma, the proliferative phase of the endometrium. But look here, the endometrial glands are all getting distended, and they are also a little more in number. So we call this a kind of a simple hyperplasia. But sometimes you find that the endometrial glands can become like this also, slightly irregular, more crowded. The stroma is also cellular, and this is called a disordered proliferation of the endometrium. So this is an example of a pathological hyperplasia. Now, what are the remarks that we should bear in mind until now? All the changes that we have seen, atrophy, hypertrophy, hyperplasia, are all reversible. But then what is there for us? Atrophic testis can be a specimen for you in the exam. Hypertrophy of the heart, in many a college it is a specimen. Benign prostatic hyperplasia is a slide. Cystoglandular hyperplasia, you might have to explain. Proliferative phase endometrium. Earlier, it used to be a slide for the students. Viva voce, anything can be asked. What is atrophy? What is hypertrophy? What is hyperplasia? And they are all short notes. And any number of MCQs can be set from these topics. Now look at this topic, metaplasia. I would like you people to kindly focus all your concentration on this particular topic. Definition. It is the replacement of one adult tissue by another due to varied differentiation of the basal cells. As I had mentioned earlier, definitions are definitions. And the word literally means meta means different, plasia means proliferation. Look at this over here. These are all columnar cells which have arose from the basal layer or the basal cells. Now, when it is different, we call it as metaplasia. We will be seeing it in the subsequent slides. The types of metaplasia should be divided into epithelial metaplasia and connective tissue metaplasia. Let us see the examples. Now, look at these diagrams carefully. I am going to explain the squamous metaplasia. This is a diagrammatic representation of the uterus, the body of the uterus, the fallopian tube, but we are more bothered about the cervix. The cervix has got what is called an ectocervix made up of squamous epithelium and an endocervix made up of columnar epithelium. But when there is a lot of infection, irritation, etc., the sensitive columnar epithelium is getting replaced by the squamous epithelium. This particular diagram you shall and will draw. The concept is from Robbins. And this is a microscopic picture from elsewhere. I find that the columnar epithelium is getting replaced by the more polygonal stratified squamous epithelium over here. Columnar epithelium is sensitive, whereas this is more resistant. And this is the text that you people should write. Metaplasia basically is a double-edged sword. It is like catching a falling knife. You can save the knife or harm your hand. It is a double-edged sword because the sensitive columnar cells are lost. Because of that, you find that the various functions like ciliary function, secretory function are all being lost. They are being replaced by the more resistant squamous cells. The cells don't get destroyed, but then they can go in for a squamous metaplasia, dysplasia, and even a carcinoma. So this is important that we should bear in mind. So the important properties such as mucus secretion, ciliary clearance, particularly in the bronchi, are all lost. And these can be the causes for it. Infections and irritations. Smoking, particularly in the bronchus. So this is the respiratory epithelium. I am finding ciliated columnar epithelium, various functions are there. We have described it under the respiratory system. They are being destroyed and they are being replaced by the more resistant stratified squamous epithelium. I should be able to appreciate these words in your answers. Ciliated epithelium, goblet cells, squamous cells, basal layer, what can be the various causes? This is something that all of us undergo. You find that there is an acid secretion in the stomach and then it goes into the esophagus. And the patient presents with what is called a heartburn. The source of the picture is this. This can happen after a spicy food, late meals, in type A personality, people who get irritated frequently, obese individuals, and they present with what is called as a heartburn. Heartburn in the sense the heart is burning. Not really, but it is a gastroesophageal reflux disease, GERD, otherwise called the Barrett's esophagus. This is a beautiful picture from Johns Hopkins University. I would like you people to kindly appreciate what I am saying. So this is the normal squamous epithelium that we are finding in the esophagus. It is the reverse of the bronchus and the cervix. Here I find that the columnar epithelium replaces the squamous epithelium because all the gastric glands, intestinal glands, etc., they are more resistant to the acid. Therefore, these cells replace the squamous cells. So this is a glandular metaplasia, a gland replacing the squamous epithelium. But if left untreated, it can go in for dysplasia. Very rarely there can be a carcinoma also. This is a beautiful diagram. I would like you people to kindly explain. Look at this stratified squamous epithelium being replaced by columnar epithelium and the gastric or the intestinal glands. This is called Barrett's esophagus. It is a classical example of glandular metaplasia. And coming to the last example, this is one. A 9-year-old child has a history of a mild trauma. There is no fracture of the limb. And then they found that there was a hematoma that was there. It resolved on its own. Should be yes and not C. It resolved. And later an X-ray showed some kind of a radio opaque picture. I had explained to you people under calcification, opacity is only because of bone or calcium. And this is what is the diagnosis? It is a connective tissue metaplasia called myositis ossificans. Myositis ossificans. This is a classical example. I hope you people have all got an entire list. If metaplasia is asked as a question, you should mention the definition, what are all the causes, what are all the types, epithelial metaplasia, connective tissue metaplasia, and finally, this is a quote I would like to finish it with. All failure is failure to adapt. All success is successful adaptation. A nice quote. Thank you.